So you might think that your beard transplant starts growing right away, but it takes time. I'm Dr. Anthony Frohl. I'm the head of the Philadelphia Hair Restoration.
I'm Dr. Nam. I'm the Assistant Director at Hair Restoration Philadelphia.
The initial healing phase will result in you feeling some discomfort in the area. There'll be some redness. Do not expect hair growth again to begin immediately. You may have some itching in the areas. Also, during the first 24 hours, there will be some scabbing, as I mentioned before, so expect that. So it's perfectly permissible to take anything for discomfort at this time, any over-the-counter medicines such as Tylenol, ibuprofen, to leave any of those. Generally, pain is not going to be significant, but if you do have some soreness, you can take any of these, or if you need prescription medicine, we always will offer that to you.
So up next is the shedding phase. The shedding phase happens within first 1 to 2 weeks the procedure. A lot of people worry that when they see the beard, the hair come out, they worry because they think it's the follicle actually came out. But the shedding phase is just when the follicles are relocated, their cycle resets and the old hair does come out. So you don't have to worry about when you see any hair falling out from the shedding phase. But this will happen anywhere between first to even up to 4 weeks from the surgery, and it's just totally one of the natural healing process as well.
Dr. Nam, as you know, we also call this shock loss,
right?
Which is kind of a big name, but basically, I think what people need to know is they're not losing the follicles. They're just simply losing the hair shaft. The follicle is what's going to cause the growth of the new hairs. So people should not be alarmed whatsoever about shedding of just the hair shaft. The follicles are getting ready to grow new hair.
So early growth phase starts anywhere between 3 to 5 months. So this is time when you're gonna see a little baby hair come out. Even the hair come out, they are still in baby stage, meaning they are a little bit fine. The shaft is kind of weak. But as the months go by, those baby hair will become thicker and become regular hair. Thickening phase happens after anywhere between 5 months from the actual surgery. When the baby hair come out, they are really fine, thin, still in early stage of the hair cycle. But starting from 5th month, they will become thicker and they will continuously grow to become thicker hair up until anywhere between 10 to 12 months.
So what are the final results of a beard transplant? So if you want a timeline for, let's say, permanence of where your beard is going to be at completion, and this is your beard transplant results, look for about a 12-month period for that. Variable with one person versus the other, but a timeline would be around 12 months.
What is the post-op care for beard transplant? After the transplant, the first couple of days are very crucial because the graft that we put it in, they are really in fragile stage. So especially when you are chewing or something or eating something, it is important that you stick to like the soft food. Also, when you are sleeping wise, the position wise, as long as nothing really rub against the beard area, the graft area, it is okay to sleep comfortably, whatever the position that you desire, just to make sure that nothing really touches the graft area.
And then one of the other post-operative recommendations that we tell our patients is in terms of cleansing the beard, washing the beard, which is very similar, as you know, to how we instruct people after a scalp transplant, which is a pour technique, P-O-U-R, technique of pouring warm tempered water over the beard using a small amount light shampoo with hands, avoiding a hard face cloth. And you could still keep if you have residual beard, your face clean, but without trauma to the follicles that were transplanted.
For shaving after the beard transplant, you have to wait minimum 2 weeks for them to really set it in. However, if you need to shave either mustache or other part of the beard that you need to shave, you can do that, but make sure that you don't touch graft area where we put the new follicles in. You can try to blend them in, but just make sure for 2 weeks, just protect the area where we put the new graft.
So what are the common side effects after beard transplant? So when we talk about side effects, we have to think about things that are expected. So you might say a side effect, for example, we spoke before about itching. Itching is a side effect, expect it. Expect redness or inflammation because simply you've had a surgical procedure done, so that's common. Expect some discomfort afterwards. But in terms of any any serious side effects. When I say serious, I mean serious infections. Bleeding is very uncommon. You can have this little, what we call punctate bleeding, little micro bleeding that form these little scabs. But in terms of any significant bleeding to be concerned about, it's really unheard of. So what are some recommended lifestyle either changes or maintenance after a beer transplant? Basically, you want to keep yourself healthy, which might sound boring, but we're talking about proper nutrition. If you're getting a good diet with all 4 food groups and you're getting vitamins that you need within your food, then you really do not need to take any supplemental vitamins after beer transplant. Hydration is very important, so you want to keep yourself hydrated and avoid dehydration. And hygiene, just a general hygiene that you maintain all the time. You're going to do the same with the beer transplant, although you're going to be more gentle with it. As in healing of any type of surgery, avoid excessive alcohol intake, which basically dehydrates you. And number 2, the side effects of increased alcohol intake to the extreme is you neglect nutritional intake. So, and smoking has been shown to interfere with good healing. It robs the general area of good oxygenation. So we clearly tell people to avoid smoking after beer transplant procedures for as long as they possibly can.
So when can I use the beer grooming products again? So before we can use any products, we have to wait until the newly graft follicles are really settled in and become strong before we can irritate them. So we have to wait minimum 2 weeks to use any the products on beer, making sure that they are strong enough to take any other outside irritants and still strong enough to survive.
And that would go, of course, for stiff brushes and so forth. Yeah, whether you're correct, wait at least 2 to 3 weeks for a brushing with anything that is coarse, if you will. So what can you do in lieu of or instead of using beer products initially after the procedure? Really, I think you should consider sacrificing using these products for the success of the beer transplant. If you really must, you could wear a mask, but however, realize that you're looking for long-term success here. So sacrificing 1 or 2 week non-grooming products will be well worth it in the end. We should have our patients really try not to panic after they expect the beard growth in a month or 6 weeks. That's just not going to happen. So if they have the expectations of that early growth, that's not realistic. And at the time, if they get into the 9 or 12 month period and they don't have the success that they'd like, then certainly they should contact us at that point.